34 years ago, Heather's dad, Terry, and I were healthy, strong, athletic, young adults in our early 20s. There was no reason to think that we would have any kind of unusual occurrences with any children that we might have. So our view of our future was basically what you could imagine a lot of Americans dream of. Having a family, having a home, grandchildren, maybe even a white picket fence and a dog. And that's pretty much what we thought life would be like. So during my first pregnancy, I did think once, what if something's wrong with my baby? And I thought, look around. Look at all the normal babies born every day. There's nothing wrong with your baby. And I never worried about it again. People would ask Terry, what do you want, a boy or a girl? And he'd say, I don't care, as long as it has 10 fingers and 10 toes. So we went along a normal pregnancy, other than I had morning sickness 24/7. I never could figure out why they called it morning sickness. Finally, 9 months later, I went to the doctor expecting to hear when I was going to deliver. And he said, see you next Friday. I was depressed, as you can imagine. But he was right. So the next Friday, I went back to that doctor, hoping to hear that the baby was going to come soon, and I heard, see you next Friday. I was so mad at him for that. But again, he was right. The next Friday I went back and he said, I don't think I'll see you next Friday. Right again, I went into labor. I went to the hospital, and as I was riding in the car, suddenly I had this intense feeling of panic. I can't change my mind. I can't get out of this. I have to do this. It felt like claustrophobia. When I arrived at the hospital, the kind nurses calmed me down and assured me they would give me something for pain and everything would be all right. As I was being wheeled into the delivery room, I saw shelves filled with piles of pink and blue blankets. And I thought, I wonder if I'm going to have a boy or a girl. Because ultrasounds weren't routinely performed back then, so we didn't know the sex of our baby. In the delivery room, there was a big round mirror that was up on the ceiling. It was at a perfect angle so that we could see the birth of our first baby. As the head crowned, I saw dark hair. I was so excited. I thought, yay, our baby has hair. Then the doctor pulled the rest of her body out and said, you have a girl. And I thought, yay, I have a girl. He placed her on my abdomen, and my eyes locked on her arms. As you saw in the pictures, they were bent 90 degrees. It's not something you could miss. But right away, my mind went into denial. No, they're not bent. They're going to straighten out. They're just all scrunched up from being inside you for 10 months. Just give them some time and they'll straighten out. They're not bent. But then I heard Terry say, what's wrong with her arms? And then I knew they are bent. So I said to the doctor, is everything else all right besides her arms? And the doctor said, I'm sorry, Debbie. She only has 8 fingers and 8 toes. I couldn't believe it. It was unreal, unbelievable. It just seemed like a joke. And then they took the baby away because she needed some further attention. And the doctor looked at me in my eyes with all the compassion that you can imagine, and he said, I am so sorry, Debbie. This isn't the kind of baby I anticipated for you. I was wheeled into the recovery room, and immediately my mind just took me to the safe place of denial. And Terry went to call our parents. I just kept thinking, no, this isn't happening. I'm just going to go home and I'm going to pretend like none of this happened. I didn't have this baby. I'm going to start all over again. I'm going to get pregnant. I'm going to have a different baby. Everything's going to be okay, and we're going to put this behind us. Terry walked in, and I said, I don't want this baby. And he said, I don't either. What are we going to do? And for those of you that are really uncomfortable right now, because Heather's sitting right there, and I'm saying I didn't want her, I want you to know, Heather understands knee-jerk reactions, and she understands denial. She's had a few of those feelings herself about different things in her life. And she's experienced 34 years of unconditional love. So you don't have to worry. I was wheeled into my room, and I was relieved that there was nobody else in my room. The pediatrician came in. He'd done a thorough examination, and he came to tell me more about my baby. He told me she had a cleft palate, a hole in the roof of her mouth. She wouldn't be able to suck a nipple, and she wouldn't be able to nurse. And then he went on to say, at least everything's symmetrical. And I said, symmetrical? And he said, well, everything's the same on both sides. Her ears are the same on both sides. Her hands are the same on both sides. And I said, is that the best thing you can tell me about my baby? And he said, well, it is a good thing that it's symmetrical. And I said, can she see? And he said, well, we really don't know. Her eyes are still swollen from birth. There is something wrong with her eyes. We're just not sure what it is. We'll just have to wait and see. I said, can she hear? And he said, well, her ear canals are so tiny, we can't actually look in and see eardrums. We'll have to wait and see. So I really didn't know a whole lot about my baby. After the doctor left, my mother came in, and she had a big, beautiful bouquet of flowers. And she said, the minute I saw these flowers, they reminded me of a Heather. And I thought, oh yeah, I was going to name a girl Heather. So her name became Heather. Then after my mother left, and after all of our visitors left, it was late, because Heather was born in the evening. Terry and I were exhausted. He went home, and I was left alone at the hospital. And I cried myself to sleep. And I would wake up suddenly, like I'd had a nightmare. I'm sure all of you have experienced that. And all of a sudden you think, oh, good, it's a nightmare. So I'd wake up and I'd think I had a nightmare, and then I would remember, it's not a nightmare. It's really happening. It's true. And I would cry myself back to sleep. And that happened several times that night. In the morning when I awoke, I was full of emotion, and I didn't know how to face the day, and I didn't know how to face my new reality, and I didn't want to. I wanted to hang out in denial. I called the nurses station, and I asked them to hold all my phone calls. I couldn't bear to hear the words, I'm so sorry. If I heard those words, then it would be a lot harder to hang out in denial. It would force me into a reality to admit that something had just happened that I didn't want to be happening. So I stopped all my phone calls. Terry came and saw me for a few minutes, and then he went off to work. And I just cried that whole day. Later that afternoon, mother instincts, curiosity, I'm not sure what it was, maybe a little both. I wanted to see my baby. I climbed out of bed and I walked down to the nursery. And I stood outside the nursery window. And inside the nursery was only one baby. And the name on the nameplate was Heather Madsen. And I looked at her and I thought, that poor baby, she's in there all alone because all the other babies are with their mother, and her mother doesn't want her, and I'm the mother. Tears were streaming down my cheeks, and a kind nurse put her arm around my waist, and she said, would you like to hold her? And I said, okay. So I scrubbed up, and I went into the back room, and I sat in a rocking chair, and I waited. 2 nurses came in with Heather, and they said, it's time for Heather's feeding. Would you like to watch us feed her? And I said, okay. So one nurse propped Heather up in a little sitting position, and the other nurse got a special feeder called a Breck feeder. It looks a lot like a turkey baster with a tube on the end, because they needed to get the formula to the very back of Heather's throat so that it wouldn't come out her nose before it went down to her stomach. So the nurse started feeding her, and the milk was just flowing out of her nose and out of her mouth. She looked like she was drowning in it, just glub, 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 glub. There's nothing more painful than to watch a baby struggle to breathe or to eat, especially when that baby is your own. They cleaned her up, and they placed her in my arms and left me alone for the first time with my new baby. And as I looked down at Heather, and I thought, this is the baby that was inside me, the one that was kicking, the one that was moving, the one that I'd been talking to and preparing a nursery for. This is the one. And I was actually marveling at the miracle of creating another human being and bonding with my new baby. The nurses came in and took her back to her isolette because she needed to be watched closely to make sure she was going to be doing okay. I went back to my room and I actually felt excited. I really did feel like a new mother now. My dad was there, and he hadn't heard, nobody knew that my first reaction was that I didn't want her, but my dad, being protective and wanting to take care of me, said, I just want you to know, if you don't want this baby, I've made some arrangements, someone that will take good care of her. And I said, no, it's okay, Dad. I want to keep her. Do you want to see her? So my dad and I walked down to the nursery, and the nurses held Heather up to the window, and she looked beautiful. She had a pink bow stuck to her head. She had a t-shirt with long sleeves, so I couldn't see her arms. Her eyes were closed. She just looked like a beautiful baby girl. And she even looked like she had olive skin, like my dad and me, which I was excited about. So I went back to my room, and after my dad left, Terry came from work to spend the evening with me. I was hoping that he wanted to see the baby, but he wasn't ready yet. I'd had the whole day to get used to having Heather and getting used to our reality, but he'd been at work, probably distracting himself, maybe even hanging out in denial, where I'd been earlier that day. He wasn't ready. They brought us dinner. It's like a celebration dinner. So the piece of cake had a little pink baby on it. But instead of being a happy moment, it actually made me sad to see that, because I knew that this was supposed to be a really happy time, and it wasn't. It was sad. We started to eat our dinner, and then there was a knock at the door, and in walked the white coats. There must have been a dozen of them. And the leader of the pack, Dr. George Vesey, later we came to know him as Uncle George, heart specialist, said, I was at home, just about to eat my dinner, and I got a phone call. They told me everything that was wrong with this baby, and they told me she had a heart murmur. And he said, I wondered, why are you calling me? Obviously, this baby has so many problems, she's probably not going to live. He said, but I just couldn't eat my dinner, knowing I hadn't tried. So we're here to ask your permission to transport her to Primary Children's Hospital so we can do a heart catheter and find out why she has a heart murmur. So we robotically signed the papers, and then he put some more papers down and he said, "Would you be willing to sign permission to do an autopsy?" So we signed those papers too, and then they left. And we said, "Autopsy? Obviously, they're not expecting her to live." So we were processing that new information, and we actually started to feel rather comfortable with that idea, because we didn't know how to take care of her, and we didn't know how much she would suffer. We began to think maybe that's the best thing that could happen. We were expecting a phone call from the doctor, but instead of a phone call, we actually got the doctor in person. And he walked in with a smile on his face, and he said, "If I'd known her heart looked that good, I wouldn't have done anything." And he sat down, and he drew me a picture of her heart, and he told us that a valve that normally closes when a baby is born hadn't closed yet, but that usually they close by the time they're a year old. That she was still having trouble breathing, and she had jaundice, so much for the olive skin. So she needed to stay in intensive care at Primary Children's Hospital until they felt like she was stable enough to go home. Well, that night, we decided there's no point me staying in the hospital for the 3 days that were allowed by insurance back then. We didn't have drive-by deliveries back then the way they do nowadays. We were actually allowed to stay in the hospital for 3 days. But I couldn't really see any point staying in the hospital because my baby wasn't there with me. And all I wanted to do was go to Primary Children's Hospital and see her. So the next morning, Terry picked me up. I got gathered up all my things, and it was hospital policy for me to sit in a wheelchair. As I was being wheeled out, that was such a sad time. Because when I was pregnant, I kept imagining that special, magical day when we would be leaving the hospital with our new baby, and she would have the new outfit on that I crocheted while I was pregnant, the only thing I've ever crocheted in my life. And I would wrap her in the blanket that was tied at my baby shower. It was going to be such a wonderful day. But instead, I was leaving the hospital empty-handed. I couldn't wait to get to Primary Children's Hospital. When we arrived, we had to scrub up to go into intensive care. And as soon as we walked in, I could see Heather in her little isolette helping her breathe. She looked so small, so helpless. But in the isolette, next to Heather, was another baby. Only that baby didn't have any arms, and that baby didn't have any legs. It just had little flippers at its shoulders and at its hips. And the parents were our age, and this was their first child. And there was no explanation and no reason why their child was born that way. And for the first time, I had the most profound experience of appreciating what I have, focusing on what I have, not on what I don't have. My baby had arms, and my baby had legs. They were little arms, but they were arms, and I appreciated that. When I went home that night, it was a very sad time, because I went home to the empty nursery with no baby. And when I laid on my back and my stomach was flat, I felt an intense loneliness and emptiness. I couldn't wait to get back to the hospital the next day. And that's where I spent every day, from the minute I got up and got dressed and arrived till they pretty much kicked us out at night. Holding Heather as much as they would allow me to hold her. I couldn't wait to take her home and be her mother. But they were worried because she wasn't getting enough nutrition because of her cleft palate. The formula, she just wasn't getting enough. So they told me if I wanted to take her home, I would have to learn how to tube feed her. I was scared, but I wanted to take her home. So I learned how to tube feed her. And they taught me that the way you know the tube isn't in her lungs is if you put it in a cup of water, it will bubble if it's in her lungs. So if it doesn't bubble, then you know it's in her stomach, and you're okay to put the formula down. So I took Heather home. Luckily, I didn't have to tube feed her because a nurse had brought me a lamb's nipple, which is about 3 inches long, and I put that on the end of the breast feeder instead of the tube. And I'd squeeze the ball, and it would squirt the milk down her throat. And I literally sat in that rocking chair most hours of every day, just feeding Heather. So I got pretty hooked on all the soap operas that were playing at that time. So it came time to go to one of our first big doctor appointments because they closed the soft palate at 6 weeks old. She'd been in the hospital 2 weeks. So we were going to that doctor pretty early on after I got her home. So I was waiting for the plastic surgeon to walk into the office where I was waiting, and in he came. And the first thing he said was, "What's her problem?" And I said, "Well, the doctors think she has a syndrome called Treacher-Collins." And he said, "Well, that's not her only problem." And he said, "Did you and your husband do drugs?" And of course I'd been asked questions about our habits before we got pregnant, but I'd never been asked that question like that before. He went on to tell me about the surgery. I don't think I heard very much. I was way too upset. As soon as I left his office and got into the safety of my car, I burst into tears. The cold, harsh reality of what I was facing and the cold, clinical nature of that doctor was just too much for me to bear. So I went home and I got on the phone and I called the office and I said, "I don't want that doctor to do surgery on my baby." And I asked for his associate. So his associate did the surgery. Terry, their dad, spent the night with Heather, and I came up first thing in the morning, 6 a.m., so that I could meet with the doctor and hear the latest news about her progression. So when I got there at 6 o'clock in the morning, in walks Mr. Wonderful. I was trapped. I had to deal with him. That doctor was the one that was doing rounds at 6 a.m. every morning. However, I experienced another side of him, the compassionate side, the caring side, the side that probably was the reason why he became a doctor in the first place, because he was really committed to healing people. And I got to really like that doctor. Plus, he was funny. He made me laugh. I really liked that side of him. Yes, sometimes he could be sarcastic, and I don't really like sarcasm much, but I really liked that doctor. When Heather was about 1.5 years old, I got a phone call from the geneticist. He said, "Come to my office. I'd like to discuss something with you." So we went to his office, and he said, "We don't think she has Treacher-Collins. We think she has a syndrome called post-axial acrofacial dysostosis." Thank heavens it's called Miller syndrome now. And he said, "There's only 3 cases that have been reported in medical literature. And the good news is, we believe it's a spontaneous mutation. The cells just started dividing and they continued, and this is what we got. And it won't happen again. In fact, the chances of it happening again are even less for you than it would be for someone else, because it already happened once." Kind of like being struck by lightning, I guess. Well, I was happy to hear that, because I wanted to have another baby. So about 1 year later, I decided that it was time to get pregnant. I thought it would be better to have a boy than a girl, because I was worried that Heather would have, if I had a girl, she would have a little sister that could do things she couldn't do, and she'd compare herself all the time. So when I found a magazine that gave instructions on what to do to have a boy, I decided to follow the instructions, and I guess it worked. That pregnancy went along normally, and the morning sickness subsided at 4 months, a more normal time for morning sickness. However, it was still 24/7. But I made it through that first 4 months and continued on. Later in the pregnancy, I just felt like I wanted to be prepared. Even though there was no reason to think that this baby would have any problems at all based on what I was told by the geneticist, I still wanted to be prepared. I didn't want to wait until I was in the delivery room to find out. So I had an ultrasound done and was relieved to hear that I was pregnant with a healthy baby girl. So when the time came, I went into labor, and it just so happens it was April Fool's Day. So when we drove Heather to my mom's house, my little brother said, "Hey, you should play a joke on people and say you had a baby just like Heather." And I said, and then say April Fools, and I said, "Oh, that wouldn't be very nice." So we went to the hospital, and I'll tell you, being wheeled into that delivery room, and once I was settled in, ready for the birth, you definitely could have heard a pin drop in that operating room, because it was the same doctor that delivered Heather, Terry, me, and one nurse. And all of us were in suspense. Even though there was no reason to think there would be any problems. So Logan's head crowned, and the doctor helped him out of my body and said, "You have a boy." And it was the same bent arms. It was unbelievable. Terry said, "Son of a..." It was just indescribable how unreal it was to see the same arms. Well, I was worried about the cleft palate part, because I really wanted to nurse. I heard the weight falls off much faster than nurse. And I'd made a great big tape and appliqued a sign on it that said, "Out to lunch." And I was going to wear it when I nursed in public. I had it all figured out. So I said to the doctor, "Does he have a cleft palate too?" And he said, "Yeah, he has a cleft palate too." Darn. So they took Logan away because he was having some trouble breathing, and they wheeled me into recovery. And the pediatrician came in and he slapped me on the leg and he said, "Congratulations, you just made medical history." I don't remember being offended by that. But when people hear that he said that, they do wonder. I asked him if I could hold Logan, and he said only for a minute because Logan was having some trouble breathing. So I held Logan for a few minutes and was just filled with love for my new baby boy. And then they took him away. They were able to keep him in that hospital, even though he was having trouble breathing, and they weren't really sure why. And I decided I'd stay in the hospital for 3 days since my baby was there and I had someone taking care of Heather at home. But I was really worried about my friends. I was worried about them finding out the news through the grapevine. So I called my first friend and I said, "Hey, I got my boy. He's just like Heather, except he has red hair." Silence. And then she said, "April Fools." I said, "No, really. He's just like Heather." And I spent time helping calm her fears and worries. Because we'd had Heather for 3 years and we loved her a lot, and we certainly knew a lot more, and she was on her age level in everything that she was being tested for by a health nurse that came to our home every month to see if she was progressing the way she should be. It removed some of my fears. My greatest fear was that he might not live, and I desperately wanted him to live. Finally, I went home, but we had to leave Logan at the hospital, so he was there 2 weeks. So the day came for us to pick Logan up, and I didn't want Heather to be jealous. So I bought her a rubber baby doll, one that could get wet. So basically she could take care of her baby and do anything with her baby that I was doing with Logan. So at the hospital, Terry placed Logan in my arms and Heather's new baby in her arms. So we all went home together to start our life as a bigger family. Logan was having trouble with the landlord, and within a week, I had to rush him back to the hospital because he'd aspirated on the formula and now had aspiration pneumonia. And it scared both of us. It was intense and scary and upsetting. So when he was well enough, I brought him home and committed to tube feeding Logan, which I did for 6 months because I didn't want that to happen again. Well, here came time for that first appointment again. Got to go see the plastic surgeon about the cleft palate. I couldn't wait to show him Logan because I knew he had a sense of humor and I knew he could be really blunt and dry and clinical. But now that I was familiar with it, I was actually curious to see what he was going to say. So when he walked in the office, he said, "You got fixed, didn't you?" And I said, "Well, I didn't, but their dad did." And he said, "Well, maybe you should get fixed too so this doesn't happen again." And then he leaned his head out the door and he said, "Come here, you guys got to see this. It's like 2 peas out of the same pod." So our life began with doctors and surgeries and a different life than that American dream that we dreamed about. So the rest of the story is a long story, but a story that I was compelled to tell. So I wrote a book called 8 Fingers and 8 Toes because I didn't want all the lessons that I've learned from being Heather and Logan's mom to die when I died.